Okay, so for what we're going to do now, we're going to look at structures that are palpable on the equine hind limb. Okay, because I don't have the pelvis here, I'll need to take you over to a skeleton, and we'll be going back and forth between the skeleton and the specimen here. So on a live horse, we should be able to palpate the tubercocci and the tubericii. Okay, and then about 2/3 between those, we should be able to palpate the greater trochanter of the femur. And sometimes we can come down here and palpate the third trochanter. So on this specimen, our greater trochanter is right about there. Okay. And sometimes you can palpate that third trochanter. Okay. But we come down here distally, and we can see our lateral epicondyle of our femur here. And really on the hind limb, the best place to start for palpating around the stifle, I find, is down here. You find the tibial crest and you take it up to that tibial tuberosity, which is right here. From that, you can put your fingers on either side of the intermediate patellar ligament, and then on either side of that you can palpate the lateral and the medial patellar ligaments. Okay, being that this guy isn't bearing weight, it's a little bit harder to palpate those. Okay, if we come back down here to the tibial tuberosity, we can see right here the extensor groove, and just the other side of that is going to be the lateral condyle of the tibia, and then the head of the fibula. Okay, and we should have a very nice collateral ligament running through here. And if we palpate over these structures, especially the head of the fibula, we should be able to find a nerve popping through there. Okay, it's going to be right there. That's going to be the common peroneal nerve. Okay, sometimes you can palpate the superficial branch between the heads of the long digital extensor and the lateral digital extensor. So somewhere right up in here, you can possibly palpate that. Okay? Now if we go back to the caudal aspect here, we can palpate the common calcanean tendon coming down to the tuber calcanei. Sometimes you can actually palpate the tendons of the superficial digital flexor and the gastrocnemius as they twist around. But what's nicely palpable, more so on the medial side, you might be able to see me popping it with my finger on the other side there. That is the tibial nerve. Okay, so here we are now at the tarsus. We have our calcaneus, which comes up to here. We have the bone right here. We can feel our lateral malleolus, and we can feel our trochlea. And here we have a very stout collateral ligament coming from that lateral malleolus down to the calcaneus. Back here caudally, we can palpate that superficial digital flexor muscle tendon here, and we can follow it on down, and it's going to join the deep digital flexor tendon just deep to it here, or dorsal to it. So we can palpate both of those. Here we can palpate the splint bone. Here's the, let's see, the base of it up here. We can palpate it down to the button of the splint here. Down here more distally, then we can also palpate the suspensory ligament coming up into here. Okay. Here we can see that tendon of the long digital extensor coming down, and then right in here we have the tendon of the lateral digital extensor coming down to join it. Okay. On this lateral side here, running from the tuber calcanei down to the tarsus, is going to be the long plantar ligament. That's going to be a nice firm structure in through here that feels like bone. Just as in the front limb, running along just dorsal to these flexor tendons will be the plantar nerves. Okay, so we'll have our lateral and our medial plantar nerves running along each side. Yes, there's going to be medial and lateral plantar arteries. They're not quite as big, because what we have is there's a groove right in here where we should be able to palpate a pulse in a live animal, and that's going to be where the great metatarsal artery, or metatarsal artery 3, sometimes called the lateral dorsal metatarsal artery, is going to be coursing. I like dorsal metatarsal artery 3. It's going to course through here, and then about here it's going to go between the splint bone and the cannon bone, and then divide into our medial and lateral plantar digital arteries, which will course just as our palmar digital arteries did. Much of our distal palpation here is going to be very much like what we saw on the front limb, with our flexor tendons back here, our proximal sesamoids here. We have an extensor branch of that suspensory ligament crossing here. So very much like what we saw in the front limb. So that down here at the stifle, we palpated the tibial crest and the tibial tuberosity, and up here the patella. Palpated the groove here where the long digital extensor and the peroneus tertius pass through. Then here we have the lateral condyle and the head of the fibula, and crossing over that we palpated the common peroneal nerve. Here at the hock, we palpated the lateral malleolus, the trochlea, the tuber calcanei. Here's where we had that ligament, collateral ligament, going between the lateral malleolus and the calcaneus. Also here on the tarsus, the long plantar ligament would be going from here to here. Okay? Here we can see the base of the splint bone. The button of the splint here has been broken off, but we can palpate the splint bone really well, and of course the proximal sesamoids here. Remember, as that cranial tibial artery came down, when it got to the tarsus, it became the dorsal pedal. It's going to give off a perforating tarsal artery that's going to go through here. And then that dorsal metatarsal artery 3 is going to come down through this groove right here, run along the splint bone, between the splint bone and the cannon bone, and then right about in here, it's going to go more plantarly and give off our plantar digital arteries, both the medial and the lateral. So now here we've skinned the limb on the lateral side, and here we can see very prominently the tibial tuberosity. We can find the intermediate and the lateral patellar ligaments on this side. And as we did before, right here we can see the structures coming through the extensor groove in the tibia. So that would be the pronaos tarsus and the long digital extensor. Okay, so here then we have the condyle and then the head of the fibula here, and we see crossing over it right here that common proneal nerve. Okay, and the deep branches are going to go deep here, and this is the superficial branch, as I said, coursing between the belly of the long digital extensor and the lateral digital extensor. Okay, we come back here caudally, we can see our common calcanean tendon. So now I've exposed this lateral hock, and we can see the lateral digital flexor tendon here, and you can see that long plantar ligament here that I spoke of. Okay, the importance of this, well, for the animal, is that the pull of the gastrocnemius and the flexor tendons would tend to pull those carpal bones apart, but that kind of gives that extra support in there. But also, if this gets kicked or some other way injured, it'll swell and it'll make a real unsightly bump on this plantar aspect of the hock, and that is known as curb. Okay? Over here, here's our long digital extensor coming on down. Our lateral digital extensor comes and then joins it in right here. You can see nicely where that's joining to come on down. Here's our superficial digital flexor tendon coming on down. And then our deep digital flexor tendon here. And as I said, we can find that lateral plantar nerve and artery are going to be running just dorsal to that. Here we can see the suspensory ligament, and right there's the button of the splint, and this is the lateral splint bone here. Okay. Here once again nicely we can see the extensor branch of that suspensory ligament coming over to join the long digital extensor tendon here. Okay. So here we're on the medial side of the limb, and on a live animal we would see a vein coming down through here, which would be the medial saphenous vein. It'll have a caudal and a cranial branch of that. Now, just as before, I find the tibial tuberosity, and I can come up here and palpate the intermediate patellar tendon, and we'll have the medial and the lateral patellar tendon on either side. Okay, right here is going to be the condyle of the tibia, the medial condyle. Now notice the tibia, the whole medial aspect of the tibia, is palpable on this medial surface. Okay, so it's just subcutaneous. We come down here then, and we're at the medial malleolus. Okay, over here we can see the sustentaculum tali, and the deep digital flexor tendons are going to be passing over that sustentaculum tali. Okay, out here's our tuber calcanei once again, and our superficial digital flexor tendon is coming on down through here. Okay, so more distally, we're going to have more of our talus here, and we can find right in here our medial splint bone. We trace that on down, and we're going to find the button of the splint right here. And we're going to find just plantar to that is going to be the suspensory ligament. Remember, the suspensory ligament attaches on the abaxial surfaces of the proximal sesamoids, and then it has an extensor branch which is coming right across in here to join to our long digital extensor tendon. Okay. Also, between the suspensory ligament and the flexor tendons, we're going to have running the plantar nerve. So the medial plantar nerve and artery are going to be running down in through here. And then likewise down here, just dorsal to our flexor tendons is where we're going to palpate our digital artery in here. Remember, it goes vein, artery, and nerve. Okay? And then right there we can palpate the ungual cartilage. Okay, let's see, anything else I want to show you? Once again, now here we're going to have our peroneus tertius is going to be palpable right about here. And as it comes down, it's going to split and give off a lateral and a dorsal branch. And then through that split, we're going to have the tendon of insertion of the cranial tibial. And it'll have a dorsal and a medial branch. And that medial branch, let's see, we can palpate right in here. That medial branch is coming across here. Yeah, I can feel it right there. And it's going to have a bursa under it here, the Cunian bursa. And that's going to be the Cunian tendon. Okay? So we can palpate that Cunian tendon running right across in here. And I think that's it. Okay, on the medial side, we palpated the tibial tuberosity once again. Here's the patella. We palpated the medial condyle. And then remember, all of this medial surface of the tibia was exposed just subcutaneous. Okay? We come down here now, and we see here we palpated the medial malleolus, the sustentaculum tali. Remember, the deep digital flexor tendons are coursing over the sustentaculum tali here. Here's our tuber calcaneus. Here's our talus with our medial collateral ligament running across this way. Okay, and then the medial tendon of that cranial tibial muscle is going to be coming across here. Okay, and that's that Cunian tendon. Here we have the base of the splint bone, and once again on this specimen, the button of the splint, which should be down here, is absent. So I've skinned the medial side here. The patella is sitting right up in here. We can see the medial patellar ligament, the intermediate patellar ligament, and the lateral patellar ligament over here. Notice our patella is sitting here, but we've got this extension right here, which is our parapatellar cartilage, which that medial patellar ligament attaches to. That's what allows the locking mechanism to occur. Okay, we can see that as I showed you before, the tibia is totally just subcutaneous along here. Here now we can see that medial saphenous vein. It's got a caudal and a cranial branch. That cranial branch coming down through here. Okay. Here we can see very prominently here the peroneus tertius. It comes, and then the cranial tibial kind of comes out from under its split, and this medial ligament of that cranial tibial is that Cunian tendon. Okay? And right up under here is going to be where that cunian bursa is. We can see here the splint bone, the medial splint bone. Coming on down, we have our flexor tendons. You can see very distinctly here the superficial and the deep digital flexor tendons. And then right in here is that interosseous or suspensory ligament. Okay, and here we can see our long digital extensor tendon coming on down. And then we've got that extensor branch off our suspensory ligament coming off over here. Okay, here we can see the vein continuing here. We can't really see the artery and the nerve real well, but remember it always goes vein, artery, and nerve in this region right here. Okay, so let's come up here now. Here we can see the superficial digital flexor tendon, and it's kind of spinning under here, and you can see right here the gastrocnemius tendon kind of spinning to go deep to that because it's going to attach to the tuberocalcanei. Okay, so here on this medial side you can see me plinging it right here. This is going to be the tibial nerve. Okay, and right about in here it's going to branch into our medial and lateral plantar nerves, which we see running just dorsal to our flexor tendons right along in here. Okay, and so there's going to be a very small artery running with that as well. Anything else? I think that's it.